Atul Birut.
Permission to start, sir?
Where you engage with some other presentation?
Yes, sir. Sorry for that, sir.
Okay.
May I have the permission to start, sir?
Yes, please go ahead.
Finish it fast.
Good afternoon, one in all. I am Dr. Atul. My topic is Trash to Technological Triumph, Indigo, a universal slit lamp mounted indentation gonioscopy photography. In 1990s, Alexio Trantas, a Greek ophthalmology, described anterior chamber angle using direct gonioscope with simultaneous digital indentation at limbus. Later on, Maximilian Salzmann used contact lens and indirect gonioscopy. Fortunately, with the naked eye is not possible because light from the iris and cornea strikes the ear tear interface at the shallow angle and it's totally internally reflected. Indirect gonioscopy lens has mirrors to overcome this total internal reflection and redirect the light perpendicular to the lens air interface. The examination performed at slit lamp. There are few devices which has been developed or are in developing stage. First is ICAM from Clarity Medical System USA. They design wide field pediatric fundus imaging, which can also be used as angle photography if you use 130-degree wide field lens. Second one is team of ophthalmologists from Singapore working on GonioPane, which is handheld angle photography device. Third is NGS1, developed by Nidec Japan and released in 2018, which is tabletop contact based angle photography device. The problem faced by most of these devices are either they have patient has to be lie down, or goniogel application, busy IOPD curtails down the use of such devices. They are costlier devices and there is no indentation advantage. Solution to this is our Indigo, universal slit lamp mounted indentation gonioscopy photography. Material used were 4 or 6 mirror ION indentation gonioscope with handle. You can use Zeiss indentation gonioscope also. Then discarded surgical marker pen, micropore, mobile adapter and any smartphone. So this is ION Vision direct view 4 mirror gonioscope with handle. Then this is used Viscot surgical skin marker 1437, which comes with the paper scale. 23 mm rear portion of the marker pen is cut and removed. And then handle of the gonioscope inserted to the cut end and fixed with the micropore tape for extra stability. So mobile adapter in the eyepiece end while goniopane assembly at the hinge joint. The height of the gonioscope lens adjusted so that the illumination slit should fall at its center. This is live indentation gonioscopy on the pre-anesthetized eye. So inherent advantages of Indigo, that is slit lamp mounted indentation gonioscopy photography, are there is no requirement of coupling fluid. It's extremely easy to use and patient friendly. It's a hands-free technique. Advantages of indentation gonioscopy also, and can be mounted on any slit lamp. So these are few of my patients like plateau iris processes, neovascularization of angle, then angle recession, pseudo exfoliation of angle, iris melanoma, etc. Take home message. Indigo, a frugal innovation of universal slit lamp mounted indentation gonioscopy. It's a feasible and easy to install. It can record and capture high definition images of the angle, digital image analysis by teleophthalmology, and can share across the world. It shows immense promise in enhancing the diagnosis and treatment of ocular condition, particularly in the developing countries. I don't have any financial interest. Thank you so much.
Thank you.
Thank you.
The device, is it attached to some part of the slit lamp, or how do you fix it to the slit lamp?
No, basically we have taken the surgical skin marker, sir, and then the rear portion of the surgical with adjustment, rear portion of the surgical skin marker, which is 23 mm, we cut it, and then we slightly preheat it so that it will become slightly malleable. And the lower portion of the handle of gonioscope, which we use, we just inserted it, and for extra stability, we just wrap it with the surgical micropore, sir. And this device we have fixed on the at the hinge joint of the slit lamp.
Okay.
If you look at any slit lamp carefully, the hinge joint diameter, it is almost same for the most of the slit lamp. So we used and we have tried at the killer microscope, then Appasamy microscope, and others also. So it was working quite well, sir. And the height has been already adjusted. If there is some, if the diameter is slightly less, you can cut slightly less portion. So that height should adjust and the slit should fall exactly at the middle of the gonio lens, sir.
So once you attach the gonio handle to the that marker pen,
Yes, sir.
You cannot remove it afterwards.
It is a surgical marker, so it doesn't
No, you
it
told
doesn't
it's,
snugly fit exactly.
snugly
That's why we are using the surgical micro portion just to have extra stability.
Did you try taking a 3D image of your place where you're putting the lens and making a 3D printer, using it to make something like that? Because that would
no,
be
sir.
more practical, using a pen or something and tying it with a sellotape is not a very stable joint,
Sir.
right? So did you try finding out if somebody can make you a kind of a holder for your lens?
Yeah, sir, we are
With
on
the
it.
3D printer, you can do it nowadays very well, very easily.
Yes, sir. We'll definitely think over it, sir. But till now, sir, we are quite comfortable, and number of patients which we are actually taking gonio photographs has been increased, sir. Because being so easy to take photographs, earlier we were so lazy that we did not take. We used to skip in busy day-to-day OPD. If it just if you
And
just
patient is quite cooperative while doing it.
patient is cooperative. It's like AT, sir, applanation tonometry. We just anesthetize with the proparacaine eye drop, one drop, and then you can just get your gonioscopy photograph. Done, sir.
How is it different from the one available that is with MI RedCam? The DGI is there, no?
Sir, this NGS one and all, they have NGS one of NIDEC. This is a tabletop based contact this thing, sir, gonioscopy, and it required this thing, sir. You have to put gel and all, sir. And
No, MI RedCam I am
pardon, sir?
talking about. That slit lamp mounted, that gonioscopy imaging system is there, no? With MI RedCam, digital gonio imaging system they have devised. So how is it different from
that
that?
ICAM you're talking about, sir?
No.
Medical place. I don't know, sir. Not aware.
So any other such kind of innovation is there?
No, not now, sir. This
How
is the first
stable
of
is
a
that
kind, sir.
attachment? What you
Pardon,
have?
sir?
How stable is that attachment? If patient moves suddenly, then how stable is that your vertical?
It is quite stable, sir, with the surgical microphone, because that is quite lighter, sir. That gonioscope is quite lighter, and it's quite stable and easy to take, sir.
Is there a learning curve for the ophthalmologist and for the patient also? How the patient should sit and how long
How the
does
patient?
is there a learning curve for the doctors? How long does it take to really master the art of your innovation? Like
Ma'am,
how to
I taught my this thing, ma'am, OPD assistant, ma'am. He is also able to take photographs, sir.
is able to
Yes.
stable, good, focused photographs?
Focus photograph, ma'am.